Okay, today we're working and getting involved in the community to develop awareness to health and wellness, and we're here now at the Irvington Housing Association with its director, Mr. Dave Brown. Mr. Brown, we're so happy that we had an opportunity to work in this capacity, knowing the extent of involvement that you have here in relationship to the constituency that needs to have the services. It's really effectively helpful for us to work with you in the capacity to make sure that we can provide these types of services. How long have you really been working in this environment?
Well, I've actually been working in a public housing environment about 20 years. I grew up in assisted housing, so I've been really here all my life. But I'm just happy that services can come to the residents. In the past, we've done services, but it's just excellent that there are people outside of the community that are bringing things in the community. In the past, it's been us doing it, and it's just a great effort, and we're excited about it.
Well, you know, we're looking forward to establishing longevity and consistency because, as you can see what's going on, it does effectively help the community. What are some of the barriers that you have seen in relationship to trying to develop services for the community?
Well, a lot of times, often things are motivated by profit and money, and then folks are not really interested in what they can do for the poor or those that are disenfranchised. They just want to see what they can do to make money off of them, and I think that's one of the biggest barriers, profit and greed.
Mm-hmm. Now, well, looking at it from that attitude, we really are working to maintain respect and integrity. We Care Partners has been developing ways in which we can provide awareness to our community in terms of being able to create responsible citizenship. The climate that really goes on in the, I would say, the kind of housing environment, public housing itself, has always been considered to be the center of a lot of the crime and a lot of the problems that we see encountered throughout our communities. How have you been able to effectively keep it where that kind of situation it doesn't get out of control?
Well, we've got security here also, but we've had social service folks, and then I think we try to make sure that we continue to keep our people grounded and continue to let them know that we're here to serve people. I have given my life to service, and it's important that other people understand that we need to serve.
Now, you and I both have recognized the value of the mayor's wealth of involvement with the health and wellness perspective in terms of the mayor's health and wellness program. Are you really seeing results from that kind of attitude that our community government is giving to us?
Oh yeah, there's no question about it. I think just their willingness to work with us, they're willing. I mean, I don't know if you're aware of just all the things that go on at the senior center and other things that they've been supportive of us. So it's definitely because there's a great effort. There, Marilyn Thomas is doing a lot of work. The mayor, Commissioner Beasley. So there's a lot of work that goes on, and the residents are aware of it, and I'm proud of it.
Well, we're going to be looking forward to partnering with you. We Care Partners is really coming into the community to participate in that area that you're saying. We're not trying to make a profit. What we're doing is raising awareness and bringing services back to the community that really needs to have those opportunities. We thank you very much for supporting us, and we look forward to a stronger engagement. Joining us now is Ibrahim Sharif, and Mr. Sharif, the ambassador of, I would say, New Jersey economics, and really knowing how to bring together various cultures so that we can set standards here in our communities. Very happy that you came by to support this effort. What do you think is really important about the idea of health and wellness and raising awareness in our community?
Well, I think it's a major priority, not only here in the great city of Irvington, township of Irvington, but it's a major priority in our nation. And I think this healthcare forum here is really what is needed, more so because I'm sure if Steinbrenner could have bought a new heart, he would have. Steve Jobs, if he could have bought a new pancreas, he would have. So you can have all the money in the world, and if you don't have good health care, it doesn't mean anything. What I'm concerned about is our nation as a whole is behind the eighth ball. There are countries in Europe and other parts of the world who have health care as a benefit for every citizen. And we, as Americans, claim to be the most powerful nation in the world, and sometimes I wonder what that means. but yet we cannot give our citizens health care. To the Congress of the United States and to the Senate, they need to want the same for themselves as they would want the same for their residents. They get free health care. The people in our country deserves free health care. And this is why what you're doing here today in the great city of township of Irvington is important, but we really got to get down to the nuts and bolts of really being more sensitive and conscientious to the citizens of the United States. And the way we need to do it is re-engineer economics. We are in 200 countries throughout the world with our troops manning the world when we need to bring those resources back home. And we really need to re-engineer our economics to invest in education, health care, our infrastructure, our environment, protect the waters that the Creator has given us, and protect the air. So healthcare is a major component.
And, you know, and looking at the idea of helping to transform our communities, education is also very important as well. Most people don't understand the value of getting these type of services because they've always been restricted. Bringing it into the community and giving them free opportunity to find out how they can take advantage of these services is so unique as well, wouldn't you say?
Well, education, you're absolutely right. Either we're watching Dancing with the Stars too much, we're watching sports, and that's okay if that's what you, but we have to, as a nation, be more conscious of the value of education in our country. Our nation, back in the 70s, on the front page of the Time magazines, which says our nation is at risk because we are still grappling with what is quality education. I don't care if you're in the suburban, rural, or urban, there should be equal opportunity for everyone to get a quality education. Well, Ibrahim, we got people on welfare, we got people with poor diets, we got broken homes. We'll deal with that later. But right now, we want, as we provide quality education, we will deal with all of those other issues that we always use as an excuse for not doing it. The world right now, we're behind the 8th ball in math and science. I just came from China. They have art, they have sculpture. They have where the students from the 6th to the 12th grade must speak English. They know about Thomas Jefferson. They know about James Madison. They know about George Washington. They know about the Constitution. But our kids know about the hip-hop. The industry of the hip-hop industry. They know about the shooting that's on television. They know about all of these stories that they are programmed to watch, and we're not paying attention to what do we need to make sure that the United States of America have insurance in terms of making sure that our nation is protected from being a third world country.
Well, we're here on site at the Irvington Housing Development with Mr. Ibrahim Sharif, and really getting an idea exactly what's important about the values of bringing these type of outreach opportunities available. The mayor and his health and wellness initiative, is that concern valuable?
Absolutely. Not because he's a personal friend, but because he's always accessible. He's the type of person you don't have to. Most politicians, when we get off work, their offices are closed. With Mayor Smith, he's always available. You can see him in the street, you can see him in the hallway. It doesn't matter. He's a hands-on mayor, and we need more of our politicians to be like that. And I think he realized and he knows the value of not only education but health care. And we need to support him by making sure that the senators and the congressmen give him more resources, as we need to give all of our communities more resources to make sure that a mayor of his quality and his care can do even a better job with the proper resources.
Well, we thank you very much for coming by, and really appreciate, and we're looking forward to working with you and some other activities. We're going to be looking at the Centenarian Project together, and we certainly are going to be identifying individuals that you have had in your lifestyle to share with us some of the most important values that we have that we need to teach our youth.
Absolutely. Thank you so much.
Thank you so much as well. Thank you. All right. Okay, we're here now with LaRon Tolliver from Iris House, and Iris House is an outreach agency that really raises awareness about what's important in getting treatment and understanding of the relationship of HIV and AIDS, and it has become really one of the silent epidemics in our community because most people are not willing to go and find out if they do have the disease, and then they find out they got it, and then it becomes a real problem. How has the outreach effort been able to develop ways in which people will feel comfortable about getting tested?
Well, the outreach developments, what we do is we go out into the community and we reach out by giving free condoms, providing HIV literature, and also free rapid HIV testing at Iris House. And one of the ways we do this is we have many different programs set up to reach out to many different demographic age groups. So we have programs like SNS that reach out to young MSMs, you know, and we also have other programs like Women Helping Women or CLA that reach out to women to make sure that, you know, they're involved in knowing their status, getting their HIV tests, and also prevention programs, mental health screenings. We also offer those different things as well.
Now, having you on board as being one of our outreach partners now is going to be very considerably important in relationship to showing individuals that they can trust that what we're going to be doing to help them is really going to help in their relationship of having a better lifestyle.
Yes, one thing we enforce at Iris House is confidentiality. So when a client comes in to get tested, or you know, if they're mental health screeners or anything, what we talk about with that client is completely confidential. So we also want to make it warm and welcoming and not just like a cold doctor's office, so that when we're out building relationships with, like at the health fair here, and persons are coming up to the table, we're making it warm and welcoming so they'll feel comfortable to get their, you know, to get tested, to know their status. Because one of the major issues is in our community, especially African American community, you know, it's like HIV, who has AIDS, and you know, it's not really talked about. It's one of those things that are swept under the rug. So we make it warm and welcoming for everyone to come out to Iris House to get tested.
Okay, so and it's really good. And we're glad that you're going to be partnering with us, and we're certainly going to be supportive in your outreach effort as well. Yes, thank you very much. All right, great. Okay, as we continue to develop an outreach effective way in which people can get involved with raising an understanding of how healthcare is important in their lifestyle, we're here now with one of the certified pharmacists that is working with us so that they can have a person here that can actually evaluate the kind of medication. Why is it so important for people to know about the medication that they're taking?
Oh, medication use, it can be pretty complicated. I mean, especially seniors, they're on extensive regimens. They may forget to take certain medications. They may not know what their medications do. So it's really important that education is there and compliance to these medications are there. And also to know the side effects of the medications, just as to make the prescriber aware. So if necessary, they maybe have to switch regimens or switch medications for the patient.
Okay. Now, in some cases, we've also found out that people use more than one doctor, and each doctor may prescribe something different, and they can have as much as they probably won't need.
And that's why it's very important to get your medications filled at one pharmacy. Even though you're going to multiple prescribers, all the records and all the medications are dispensed at one pharmacy, where the pharmacist can check for interactions and problems and alert the prescribers of any potential issues that could impact the member.
Okay.
Impact the patient, sorry.
Yeah. Now, we're looking at the idea of how important different HMOs are. The effectiveness of this particular program has been very helpful with United Healthcare.
Yes, definitely medication screening, compliance, these are all issues we stress, and to get to know your medicines and definitely discuss them with your healthcare providers.
Okay. Well, you know, we really appreciate you partnering with us. We're going to be looking forward to more activities that we can bring out to the community free of charge. This gentleman is here, a professional that can help you. When you hear about the events that we're having, we want to make sure you come out and know the people that are going to be there to help us give service to you. Thank you very much. I really appreciate it.
Thank you.
Okay. We're here with a delightful person, Ms. Arlene Coral, and Ms. Arlene Coral is with Dental Health Associates, who's our banner sponsor for today's event, where we're going to be working in collaboration with providing services and making sure people understand how important dental health is in their lifestyle. Share with us exactly why this kind of an effect or this kind of an approach is something that you all feel is going to be helpful.
Well, Herb, first, thank you for letting us be here with you, and we're thrilled to be a part of We Care Partners.
Thank you.
People don't understand that dental health is not just about what's happening in your mouth, with your teeth and your gums, but it really can affect your whole body. Your body's like a computer system, so it's like integrated circuitry. If I have a problem in my mouth, a lot of people don't know that a cavity is actually an infection in your tooth. So left untreated, that infection can pass to other parts of your body, and people have actually been known to die of heart attacks. So, you know, with any health care, the first line of defense is always preventive measures. So if you do screenings before there become problems, people can maintain what's going on in their mouth. The next thing is early detection, which hopefully we're at that point here with this community, so that treatment becomes feasible and reasonable and something that they can take care of. So if they know what they're dealing with in their mouth, they can make a plan to get it fixed.
Now, one of the things that I see that is important is the free screening. Why do that?
Well, a lot of times people aren't going to the dentist as regularly as they should. And
But why would you do this?
First of all, we try to be very involved in the communities where our offices are. We feel very blessed to have the loyalty of so many patients. We've been in Irvington for over 25 years. Our Dr. Listman, our founder, grew up in Irvington. His father actually had a practice on Clinton Avenue. So the Irvington community is very special to our office, and we know that it's not like we're trying to get everybody to come to dental health, but we are trying to get people more aware of health, and we feel these screenings benefit people in many ways. And you know, all the new research, even with pregnant women carrying a baby aren't aware that if they're not taking good care of their teeth, that can pass through to the developing fetus. And you can actually have low birth weight and premature labor, all from your mouth. Who'd believe it?
Right. Well, we also want to encourage people to understand that not only has this effectively been the approach that Dental Health Associates has been making here in Irvington, but being part of We Care Partners and our mission to create responsible citizenship, they're going to be joining our team, and we're definitely going to be going to other municipalities that are willing to greet us.
We're in 100%, and we've already been doing health fairs and community events in Newark and Plainfield and Phillipsburg, and we're in with you, and we're so thrilled to be in on the ground floor of this organization and the wonderful services it's going to provide that are so well needed, and thank you for including us.
Well, thank you very much for really giving me the confidence that you will be a part of it. Thanks again. I really appreciate it.
So nice, Herb.
Same here. Thank you. All right, we're here with one of the board members taking advantage of an opportunity. John, look at you. Look at you, John. How you doing, man?
Good, man. Good. Everything is good. When I found out how my glucose level is, I'll be doing much better.
Okay.
Yeah.
And we see that we have professionals here from the Newark Community Health Centers, and we're here now with Andrea. And tell us exactly what's really going on.
Well, actually, I'm Andrea Cheeks, and I'm an outreach representative from Newark Community Health Center. We're a nonprofit organization. We've been around 25 years. And what we do, we accept most insurances, but we don't turn the uninsured away because we have a sliding scale fee that goes according to your income. And that could go anywhere from $20 to $60. That's it. It doesn't get any higher. Some of the services we provide, we do free HIV testing, free pregnancy testing, dental, internal medicine, pediatrics, OBGYN. We have a podiatrist, ear, nose, and throat. And we have one center here in Irvington on Springfield Avenue. We also have 5 other centers, 3 in Newark, 1 in East Orange, and 1 in Orange as well. So what my flyer does is allow you to get 1 initial free visit at any one of our 6 centers. But it doesn't include the labs. And we try to get people in a medical home where they don't have to keep going from doctor to doctor.
Well, that's really good, and we know that there are some expectations, and the Newark Community Health Centers is going to be working with us on an ongoing basis to create awareness in our community about health and wellness. Thank you very much, Andrew.
Like Miss Chicks just saying, we're part of the community providing medical services. We mostly focusing on those underserved people, those who really doesn't have the opportunity to see a doctor. And we accommodate them by giving a free visit. And of course, if they don't have a way of continuing receiving service, we have social services personnel that could assist them with their financial situation. And, as Andrea, if I have to say anything else, it's going to be like we open lately, 9 to 7. And of course, we do open on Saturdays. Now we are after people who really in needs of medical services. We accept walking people, meaning that they don't need to have an appointment. As I walking on the street, I see people that said if I approach them, they said they need services. What I do is just take the name and refer them to any of those centers. The closest one, like we are in Irvington, I refer them to 1150 Springfield Avenue. If they are in East Orange, for William Street in East Orange, and of course other locations in Newark as well.
Okay, well great, we're just very happy to have you on our team, and we've been looking forward to working together in some other events.
How you doing, Yasmin?
Thank you very much. Now you're from the Horizon. Now explain to us exactly about Horizon.
Well, this is Horizon NJ Health, so we deal with Medicaid, and we have some information. We go out into the community, we go to the different centers, and we try to sign people up for NJ Family Care. We try to serve the uninsured and serve the underserved and direct them into right places. With Horizon, we try to be out all the time in the community so we could serve the people. And right here, we have some information at our table about low sodium diet and our hypertension program and our diabetes managed program. And also we have some information if you've switched an HMO, if you're dual eligible with the Medicaid and Medicare, we have some information about open enrollment as well.
Okay. Well, we're very happy that you're joining our team, and we're looking forward to working with you in some other events that we're going to be having.
Thanks for having us.
Well, thank you very much.
Always a pleasure.
All righty. Okay, we're here excited about the first time opportunity to be able to do a week here, Health and Wellness SeniorExpo, and it's in regard to supporting the mayor's health and wellness campaign. And Mayor Smith, we're very happy to have you here with Mr. Graybauer from the medical school. Some of the things that we have been able to accomplish in regard to our outreach, Mayor, has been really effective in terms of showing that it's very important that we do outreach to the community and do something where they can benefit from it.
Well, I think, this whole idea of what do we do to manage the health and wellness of ourselves. Doctors and others can provide when we have challenges, but making sure that we have an ounce of prevention is worth a pound of cure. So those things like having good dental care and basic things like brushing your teeth and doing some exercise. And so you manage that part of your health yourself. Now, if you get an acute problem, is when you end up in the doctor's office or the hospital. So we want to get in front of all of those kinds of modalities and try to prevent you from having them. And so bringing the issue of health in a community discussion about what are we doing about our health, from our young kids and childhood obesity to just getting the right exercise and eating the right food. Half of our modalities are caused by what we put in our mouths. And so now, at the same time, we appreciate the medical institutions like the medical school who are preparing our doctors or making sure they're culturally competent and that they have the best schooling to deal with those acute problems. And even the medical school wants to make you a better patient by providing information so that you can effectively communicate to the doctor what your challenges are so that he can treat you appropriately.
And that's pretty much clear to say what the mini medical program is going to be about. And in regard to it, what are we going to expect from that program?
Well, quite frankly, at New Jersey Medical School, our mini med school program is a program that reaches out to the lay community to provide public medical education for the lay public. And we offer a program starting in January, our mini med school program 2012, which will run about 9 weeks and will cover a whole array of different subjects and subject matter that are of concern to the lay community. And we strongly urge and encourage the lay community to take advantage of this opportunity so that they can get the updated information about cardiovascular disease, about stroke issues, about diabetes, and other related issues that are of concern to the community.
Well, we certainly are very happy that you're participating with us and supporting the Mayor's Wellness Campaign, and that this is something that is going to be part of the opportunity that we will develop a relationship with in the future. Thank you very much.
Thank you, Mr. Glenn, and thank you for giving us the opportunity to come down here and to share in this wonderful venue and to provide very effective and timely information to the lay public.
Thank you very much.
Thank you.
All right, we're here with one of the residents here in the housing development, Mr. Jenrette, Wilfred Jenrette, and it's really a pleasure to talk with you. Now, how old are you?
85.
85 years old, and then for those of you who are viewing, Mr. Jenrette is also a member of the lodge that I am a member of, and he's one of the oldest members of our lodge. But you're also a member of the housing development, and there has been some activity that's going on in terms of the Mayor's Wellness Program that you all have been involved with. Why don't you share with us about that involvement?
Well, I work on the garden out there with the folks out there with the garden. And I got some string beans out there. I'm going out there and pick some of them later on. and some tomatoes out there. I got some of them out there in the garden out there. So I'm working on that. So I'm waiting for them to fill out a little bit more, and then I'm going to eat some of them, take them upstairs and eat some of them.
But is it all about eating the food? I mean, does it stimulate your involvement?
I like to plant things. I just like to plant things. So I was out there and they said we wanted some help. So I just help them dig up this way and put that. But what I'm trying.
All right. Now we're out here with the mayor and Mr. Jenrette, who's one of the gardeners with the Mayor's Wellness Program. Was able to get this opportunity to give our seniors a chance to do some of the things that they like to do.
Well, we're delighted. I want to thank Councilman Beasley, who is here with us as well, because they authorize us to do all these kinds of things. So the state of New Jersey has a program called Shaping New Jersey, which means New Jersey get in shape, and they provided money for us to do. We proposed two things. One, for our senior population, that they have the ability to get out and have their own garden. And so we picked this location, and they're growing tomatoes, string beans, collard greens, cabbage. They'll be able to have healthy, fresh vegetables that they can cook in their own apartments here.
Peppers too.
You got peppers too? Red peppers or green peppers?
The green peppers.
Oh, green peppers. All right. All right. And then the other place that we did this at, we did this on a school site. We want the young people to get out and experience the activity around gardening. And, you know, there's a movement to create urban gardens. With this economy the way it is, it's often a stretch for seniors to have enough things at the end. There's more month than there is money. So by having this little stable of fresh vegetables may help some people who are struggling to make their food bill accessible with some really fresh vegetables that they don't have to spend money on. Their only cost is their sweat equity from making and taking care of the garden here. So you see this one here, he's out here shepherding the garden, but nobody better not mess with it.
I think that it's a combination of things that work here. I mean, the whole idea of getting our seniors to give probably knowledge that they've cultivated over the years in their life and share it with the community. It does a lot of things in terms of providing healthy diets also, you know, the fresh vegetables and those type of things. And hopefully the young people that's in the immediate area in Crescent Lane come over and learn some things about how to grow things, because in most urban areas there's a lack of knowledge on how and where food comes from. So it's a great, you know, activity. Give you a credit to the organizations that came together to do this, and certainly the mayor and the insight that the administration have and the support that the council gave. Here we are today.
All right. All right, thank you very much.
One of the things I want to mention is that at least I think 6 of the seniors actually graduated from I think that the New Jersey Extension program, and they're master gardeners. Yeah, I don't know. You went. You one of them?
No, I'm one of them.
Yeah,
I'm one of them in there too. Yeah, I'm in one in this garden out here with them, helping them grow this stuff out here too. So they want me to go back to school with them again this spring of the year and help